Hello, friends. Welcome to the channel Nursing Made Easy with me. Today, our topic of discussion is dacryocystitis. It is a disease condition of the lacrimal system. It's an extraocular condition. So, let us begin. First, we go to the definition. So, dacryocystitis is the inflammation of the lacrimal sac, which typically occurs secondarily to the obstruction within the nasolacrimal duct and resultant backup and stagnation of tears within the lacrimal sac. So, dacryocystitis is the inflammation and infection inside the lacrimal sac. Now, why does it occur? Because there is a obstruction in the nasolacrimal duct and resulting in the backup and stagnation of tears within the lacrimal sac, causing its infection and inflammation. Okay, now let us move towards the anatomy of the lacrimal apparatus. The tears are produced by the lacrimal glands. The lacrimal glands, as you can see in the picture over here, these are paired almond shaped exocrine glands. Each of these lacrimal glands sits in the upper lateral portion of each orbit in the lacrimal fossa. So, this is the lacrimal fossa, an area which is found within the frontal bone. This is the frontal bone. So, in the frontal bone, we have the lacrimal fossa on the upper lateral portion of each orbit of the eye, and over this each of the almond shaped exocrine glands, which we call lacrimal glands, sit. Okay, now these lacrimal glands will secrete tears which will then enter the eye through these excretory lacrimal ducts. Okay, the tears lubricate the eye and then these are collected into the superior and inferior puncta. So from here the tears will come into the eye, it will lubricate the entire eye, and then the tears will go and drain into the superior puncta. This is the superior puncta and this is the inferior puncta. Okay, and then from the puncta they will drain into the superior canaliculi and this is the inferior canaliculi. Okay, so canaliculi, from here they will pass through the valve of Rosenmuller, where here we have valve of Rosenmuller, and then they enter into the lacrimal sac. This is the lacrimal sac. Now from the lacrimal sac, they will flow down to the nasolacrimal duct and enter into the nasal cavity after passing the valve of Hasner. Okay, so this is the normal anatomy of the entire lacrimal apparatus. Now, due to an obstruction in the nasolacrimal duct, if this is the nasolacrimal duct and if there is any obstruction, the tear will build up here in the lacrimal sac. It will lead to the stagnation over of the tear over here, and there will be backup of the tear over here. So, as a result, this will lead to inflammation and infection of the lacrimal sac. This condition is called dacryocystitis. Clear? Next, move forward. Okay. So, coming to the pathophysiology, we have dacryocystitis typically occurs secondary to the obstruction of the nasolacrimal duct. The obstruction of the nasolacrimal duct leads to the stagnated tears, providing a favorable environment for the infectious organisms to grow in. The lacrimal sac will become inflamed over here, leading to the characteristic erythema and the edema at the inferomedial portion of the orbit. So, what happens? Because of there is an obstruction in the nasolacrimal duct, so the tears will not go through the nasolacrimal duct into the nasal cavity. Rather, they will build up and get stagnated in the lacrimal sac, and because there is a stagnation, that will provide a favorable environment for the infectious organisms to grow. So there is infection and inflammation in the lacrimal sac, and because of this we can see the characteristic erythema, the reddening, and the edema, inflammation at the inferomedial portion of the orbit. Clear? Let's move forward. So, what is the cause or what is the etiology? The etiology of this condition is typically due to an obstruction in the nasolacrimal duct, which we call as nasolacrimal duct obstruction. Okay. Now, the classification. This particular condition of dacryocystitis could be classified as acute and chronic based on the duration of this condition. Acute dacryocystitis, usually it being a time frame of less than 3 months. Okay, so the acute dacryocystitis usually occurs in a time frame of less than 3 months, and it requires basically systemic antibiotics therapy prior to the intervention of nasolacrimal duct obstruction. Okay, so basically this is treated by using systemic antibiotics. Chronic dacryocystitis, on the other hand, it presents with less inflammatory signs and it requires a surgical intervention for treatment of the underlying cause. Now, based on the onset, dacryocystitis could be classified as congenital and acquired. What is congenital? Now, these are typically due to obstruction of the valve of Hasner, which is located in the distal portion of the nasolacrimal duct. Okay. Now, if amniotic fluid is not expelled from the nasolacrimal system within a few days following the delivery, it can become purulent, leading to an obstruction in the nasolacrimal duct and thus causing neonatal dacryocystitis. Okay. Whereas in acquired dacryocystitis, it is basically caused due to any involutional changes caused by aging, any systemic disorders, any trauma such as nasoethmoid fractures, any surgical procedures, neoplasm, and effects of medications. Okay, so these are acquired. Now, moving on to risk factors, we have females at a greater risk of developing this condition due to a narrower diameter as compared to that of males. Now, older age again leads to narrowing of the punctal openings. It is again an involutional change, which is why we have acquired dacryocystitis. Then, dacryocystitis is also often idiopathic because of any effect of treatment. This can happen. Nasal septal deviations or rhinitis could be the cause. Any damage to the nasolacrimal system due to any trauma or even neoplasm can cause this condition. Okay, so coming to the symptoms and signs, in case of acute dacryocystitis, what we find is pain, erythema, and edema over the medial canthus and the area overlying the lacrimal sac. Okay, now this may span for over several hours to days. Okay, there can be redness, which can involve the bridge of the nose. Purulent discharge can sometimes be expressed from the puncta, and tearing may or may not be present in case of acute dacryocystitis. Okay. In case of chronic dacryocystitis, there is excessive tearing and discharge are the most common symptoms. Changes in visual acuity could also be seen because of due to the presence of a tear film over the eye. Okay, because of the excessive tearing. Okay. Now the next part we will be discussing now about diagnosis. How do we diagnose this condition? The diagnosis of dacryocystitis is primarily clinical based upon the history and the physical examination of the patient. In certain cases, cultures and gram staining can also be obtained by expressing the purulent material via the Krigler massage, which is also called the tear duct massage, from where the collection of the tear is taken, a sample of tear is taken from the patient, and then the culture study is done over that. In the patients who appear to be acutely toxic or those presenting with visual changes, imaging and blood work could also be considered. Serologic testing can be performed if systemic conditions are suspected, and CT scan may be performed in case of there is any trauma. Okay. Now coming to the management part, in case of acute dacryocystitis, the management is basically conservative management. Here, warm compress, Krigler massage, Oral antibiotics and sometimes intravenous antibiotics are suggested. Okay. In case of chronic dacryocystitis, probing, balloon dacryoplasty, nasolacrimal intubation, nasolacrimal stenting could be done. In certain cases, dacryocystorhinostomy could be done, which is called DCR, through percutaneous approach as well as through endonasal approach. In case of chronic dacryocystitis, the management is basically invasive, whereas in case of the acute dacryocystitis, the management is conservative. Okay. Now, coming to the congenital dacryocystitis, the line of treatment over here includes conservative measures like Krigler massage, any topical antibiotics, nasolacrimal probing, balloon dacryoplasty, nasolacrimal intubation, stenting, and DCR, which could be done through percutaneous or endonasal approach. Okay, now about the prognosis of this disease condition, the prognosis of dacryocystitis is good. Simple probing is highly successful. DCR has been reported to be successful up to 97%. 90% of the congenital cases resolved by 1 year of the age with conservative management. These condition. Coming to the complications. The possible complications of dacryocystitis includes formation of lacrimal fistula. There can be lacrimal sac abscess, meningitis, cavernous sinus thrombosis, and even vision loss in some cases. So this was the entire discussion. So dacryocystitis, as we came across, is a disease condition of the lacrimal system which has a very good prognosis if treated properly in time. Okay, so thank you very much, my friends. If you like this video, please press the like button, and if you want more such content, then subscribe to my channel